Hello, this is Dr. Lewerenz at Longevity Health Institute. Hello, good afternoon or evening, whenever you're catching me. Just finishing up here at the office, kind of midweek here in August. And want to share with you something about COVID-19, about SARS-2, and kind of some new studies out there and stuff you've heard me talk about before about boosting your immune system, and some actual real data, real literature, and where the rubber hits the road, and so we can talk real about this virus. The virus is real. The pandemic itself is a question, right? And we could dissect that and digress and get slightly political. But the virus is real. And you've heard me, and I've dealt with about 50 cases here in the office through telemedicine in helping individuals fight and survive and do actually very well with the infection and in recovery. But I wanted to share with you a study that just came out in the Annuals of Internal Medicine just in July, and this was reproduced in New England Journal of Medicine. And I want to tell you about the data there and kind of the story. So just a little bit of paperwork cleanup here. If you follow me on YouTube, you're probably a patient. I do want to share with you, we're in the middle of in the start of COVID-19, the pandemic outbreak in March. We are in the process of a new build and a new moving our office. So we are moving our office just down the road in Rochester Hills here, about a half a mile. You'll get an email if you're an existing patient with us regarding this. Our phone number's not changing. None of our practices, efforts, passion, etc. are changing. Just a different location, a half mile down, a little bit bigger size, a little bit bigger IV room, just to better accommodate you. But I did want to share that with you just so that in October, when we're very likely there, there's not, we don't lose anybody, and it creates less mayhem and chaos. But let me tell you about this study, okay? COVID-19, SARS-2, this virus, and here we're in a pandemic. So there's all this conflicting literature, misinformation. I had a doctor call me and actually go nuts on me about a week ago about something related to this with one of our COVID-19 patients that we treated over the phone, telemedicine with. And by the way, she's doing lovely, healed well, functioning 90-95% better. And she is almost 80 years old. But I'll tell you exactly what we did with her. But here's the thing, there's a study in the Annuals of Internal Medicine that came out just this July, so just last month, that showed that there is not even a benefit, but maybe even harm in using hydroxychloroquine in early parts and stages of active COVID-19 virus. So the study actually, the cutoff timing was if you treated somebody prophylactically or you treated somebody in the early stages, which would be the first 5 days of the virus, of the actual diagnosis with hydroxychloroquine, that the patients actually did worse and maybe was not only not a benefit, but may have been some harm. So I want to explain this because this is the controversy about hydroxychloroquine and why there's so much conflicting information and craziness going on out there. So, and this is why the doctor blew up at me. But I'll tell you, you have to know the physiology of the virus and how things work. Okay, so the virus itself, you've heard me talk about this cytokine storm that this virus, when you get a huge viral replication and a big level of virus in your body and your immune system suppressed, and that's when your own body can essentially, like an autoimmune condition, start to attack itself. And it would attack the lungs and cause some damage. So in the first stage, in the early stages of COVID-19, the low fever, the fatigue, the loss of taste, maybe the sinus upper respiratory symptom, maybe a mild cough or whatever, you want to boost your immune system. All the things you've heard me talk about, all the things you've read, high dose vitamin D, vitamin C, zinc, quercetin, curcumin, probiotics, these are all very key, okay, very, very key. A lot of hydration. Again, we use supplemental oxygen when necessary. We nebulize and use silver prophylactically and during the virus. Water-soluble silver and nebulizing is very important. And again, early stages, even oxygen can be an immune booster, but also antiviral. So we will get patients on oxygen sometimes earlier than needed, just at home. Not that they're desperate for oxygen, but you boost someone's oxygen and they have a better, quicker ability to heal. So long story short though is that's in the early stages. Now let's presume that somebody's virus gets, they have a lower immune response and their virus goes crazy and starts really replicating fast and they have a high viral load. And there's many reasons for that. Then you could get and achieve some benefit of using hydroxychloroquine because it's an immune suppressant and you're essentially shutting down your own attack on yourself, essentially like an autoimmune reaction. You're causing your own body to stop that cytokine storm, stop the inflammatory cytokines that are damaging the lungs, that are damaging the alveoli, that are creating an effusion in the lung and worsening hypoxia. And so this is where the conflicting study showed, but information is. You do not want to use hydroxychloroquine prophylactically or preventatively. Okay, you don't really want to use it in the early stages of COVID-19. Okay, you may need or want to or have some benefit. Again, it's a clinical decision based on the doctor and the presentation in the later stages or when you feel like somebody is getting into the cytokine storm. So I want to be very clear on that, and this study very much supported that, again, in the Annuals of Internal Medicine and reproduced and published in the New England Journal of Medicine in this July study that showed that there is no benefit prophylactically or early stages of COVID-19 using hydroxychloroquine. You can actually damage and hurt somebody. And this is where I had a doctor that I do the wellness and preventative model with this. I think she's almost 80, or she is 80, patient-year-old, and she did get a mild case, positively nasal swab PCR, diagnosed with COVID-19, and she did get a little bit respiratory things, low-grade fever, had some difficulty with breathing issues, a little wheezing, congestion, things like this. We put her immediately on oxygen. We put her immediately on nebulization of albuterol and silver and boosted her nutrients. And again, in 2-3 days, she turned the corner easily. But long story short is this, this doctor called me and blew up in saying, why wouldn't I use hydroxychloroquine, and why don't you prescribe this to her? She needs it right now. And he felt like she was getting worse. And I told her, you don't know the physiology, you don't understand. That might be appropriate in days to come, but it could be harmful right now. And again, she did fine after a couple, 2-3 days, and the oxygen made a huge difference, as well as I believe the nebulizing and optimizing a few other nutrients that were still on board, but we kind of used some very, very high maximal dosing of vitamin C and vitamin D and zinc, so and quercetin. So I think it's a full package. You get good results with a full immune boosting package. Now, thank God in her case, she didn't get so severe that we had to use hydroxychloroquine, but I firmly believe that that's where these studies would show and have shown that some people, when they're near intubation or they are intubated and they're hospitalized and they're in a cytokine storm, that you give them hydroxychloroquine and they do turn around and they do improve, because what you're doing is shutting down their own attack on themselves. Okay, the virus is enough, but we don't need our body attacking itself. So then the lung and perfusion and oxygenation can actually improve. So I hope this is enlightening and educating and explaining, but I believe this virus, and what makes it tricky about it and what makes it very confusing, besides all the BS, political environment, etc. out there, etc. going on out there, but the important part is timing. Early therapy prevention is very different than mid to late therapy and hypoxia and hospitalization and near intubation. They're very different stages, and you have to know when to attack and what to use at what stage. And I think that that's very, very key. Now, my take-home message is be smart, wear a mask, social distance, wash your hands, take appropriate protective measures, especially if you're elderly, obese, diabetic, immune compromised, or have pulmonary or cardiovascular disease. But I also believe this, optimize your vitamin D. Studies show this, 5-nation study. You want a vitamin D above 60, okay? You want zinc on board. You want high-dose vitamin C. You want quercetin. You want probiotics and good gut health and a good, high protein but mostly plant-based diet. You want off carbs and sugars. You want to sleep good, okay? You want to decrease in stress, okay? But you want to be extra careful if you have a low immune system and you're elderly, obese, or diabetic. So hopefully that helps. Share this, please, with others. Share this with your loved ones and family. It clears up a lot of misinformation, and hopefully this can help somebody out there that isn't even our patient. And my practitioners, myself, are very engaged in caring for you and new cases, and we do telemedicine around the country and bringing you the best and functional integrative wellness medicine. We're all based on solving your goals, but also putting you on a wellness preventative model or path so that things that are underlining that you don't even know maybe you have, that we correct and get you on the right path. Because God willing, we're going to keep on moving forward and existing and being here. So why not we thrive, not just survive? And why not we have enough energy and goodwill and intention and love to care for others, care for loved ones and friends and family, and have a good quality life. That's what it's all about, I believe, in doing good things. So always do the right thing. Be well. This is Dr. Lewerenz, Longevity Health Institute. Have a good evening.